living longer, living healthier, living better than ever before. Welcome to Mountain Pacific's Healthy Living for Life, a weekly series that gives you the information, education, and expert insight you need to become an active participant in today's ever-changing healthcare climate. Here now is today's program host.
With more than 1 million Americans living in long-term care facilities across this country, for many of us, nursing homes are part of our everyday life. In fact, it's estimated that 70% of people who live to the age of 65 will need some kind of long-term care in their lives. Welcome to Healthy Living for Life, a show dedicated to helping you do just that. I'm your host, Beth Brown, and today we're going to learn about what you might not know about nursing homes, including services and when to consider moving into one. Stay with us. Welcome back to Healthy Living for Life. Joining us today is Jill Holt, who is a Senior Account Manager with Mountain Pacific Quality Health. But Jill, you also have an extensive background in nursing homes as a previous life before you came to Mountain Pacific. So thanks so much for being on today to share your expertise.
My pleasure, Beth. Thank you.
So let's talk about nursing homes a little bit, because it can get confusing when we throw out some of those terms with nursing homes and assisted living. Can you kind of define exactly what we're talking about when we talk about a long-term care facility?
Sure. So long-term care facility is an umbrella term, and underneath that umbrella, you may find a variety of different healthcare settings. Nursing home is one of those settings. Also, assisted living could be considered one of those settings, and in some states, there are board and care facilities that are considered part of a long-term care spectrum of option for post-acute living or post-acute settings. So nursing homes are a little bit different, though, from the other two that I mentioned. In fact, they all vary from one another in that a nursing home will have pretty heavy regulations, and that's mostly because they accept Medicaid and Medicare funding, so that's state and government funding. Therefore, then the state and federal government entities will have regulations affiliated with that particular funding. So you'll have, in a nursing home, you'll most often find that there are more complicated service menus available. They will, whereas an assisted living may have a more limited spectrum of services. Generally, though, both a nursing home and an assisted living facility will have dining services. There will probably be transportation services in both of those entities and some assistance. However, in a nursing home, you will find a more skilled level of care and therefore a more complex and comprehensive level of assistance.
And you mentioned skilled care. So while we're just in the midst of defining terms here, people have probably heard skilled nursing facility as a term too. Is that the same thing as a nursing home, or are those different?
Well, a nursing home can have one of two different kinds of licensure. They can be licensed as a nursing home, or they can be licensed as a skilled nursing facility. And the difference between those are the rules and regulations by which they are bound. So, for example, a skilled nursing facility will have available more complex medical and rehabilitative care, while a nursing home may tend to offer more of a lower level of care. However, the day-to-day support, perhaps for somebody who needs that kind of care rather than somebody who needs something more complex. So and oftentimes skilled nursing facilities have both. So they could have, within a portion of their organization or their home, they could have some of those folks who are long-term care residents, meaning that their cares are status quo, they're not deteriorating or improving or expected to, but more of a home-like permanent feel to that care and that nature. Whereas in a skilled setting or a skilled portion of the setting in a nursing home, you may find more complex cares. You may find more equipment. You might find more staff, more resources that would then support that higher level of care.
Okay, so that makes a lot of sense. Thank you for that. And so let's talk specifically about nursing homes now. And you mentioned some of these services, but what does a person typically get as far as care goes in a nursing home?
Well, in a nursing home, you can expect to have 24-hour inpatient care. You can expect to have a nurse on duty all of the time. 24 hours a day. What may vary between a skilled nursing home and a nursing home is the amount of RN or registered nurse coverage versus other levels of nursing care, such as a licensed practical nurse. There are some distinctions between those two requirements. However, in a nursing home that's not skilled, you can expect to have meal service, 3 meals a day, substantial snacks. You can expect to have care assistants who can help transfer a person from their bed to a wheelchair or from a wheelchair to the bed. There would be anything care-wise that a person would need. If somebody needs assistance with eating, there will be staff on duty who can help to feed that person. Bathing is another example. There will be anything that a person needs to be safe in a 24-hour kind of a setting, you can expect to find in a nursing home.
Okay. And
let me mention also,
sure.
Beth, med management. Medication management is a big component. Medication management is important because oftentimes older folks are getting a lot of medications and it's very easy to get them confused or
Sure.
mixed up. And so medication management from the nurses is also a big part of that nursing home service.
Yeah, that's important. So what role do some other medical professionals play in a nursing home? I'm guessing then pharmacist or some sort of pharmacy support. But what are some of those other roles?
Sure. In a nursing home, you can expect to find, as I mentioned, nurses, certified nursing assistants. There will be an infection preventionist. That's something sort of new to the industry. That's a new requirement from the pandemic. You will see environmental service experts, dietitians, medical doctors will be required to be on site at some point to see patients and to observe their cares and make sure that they're getting the care that they need as far as medical prescriptive care that's been ordered for those particular residents. Sometimes you might see nurse practitioners, and there are pharmacists, as you mentioned, Beth. Pharmacists have to come on site and conduct audits of records and look at med storage, and so that's another component you can expect to see.
Okay, great. We're almost out of time, but I wanted to ask this question, Jill. So many nursing homes are closing right now. What can you tell folks of what they need to know about that?
Well, what we've learned with this pandemic is that nursing homes are very vulnerable. They've been very fragile for a number of years. And I think just an awareness in your community of what nursing homes do, what the struggles might be. I think educating yourself as a consumer is always really important. So just being aware of, what's required to run a nursing home, the kind of staffing that's necessary to be safe. And also keeping in mind that if a nursing home is closing, there are certain stipulations and requirements incumbent upon that nursing home before closing their doors. So the nursing home will give at least a 30-day written notice to family members and residents of a pending closure, and then they will begin to work collaboratively with residents and their families on a discharge plan that's appropriate and satisfactory to everyone.
Okay, perfect. Thank you. We are out of time and need to take a quick break. But when we come back, we're going to talk about what to consider when looking at a nursing home, including waiting time, financial help, and much more. Stay with us. We'll be right back after these messages. Welcome back. We're still talking with Jill Hult, who is our nursing home expert at Mountain Pacific Quality Health. We have a few, but you're our main one as our senior account manager. So thanks again for being here, Jill.
My pleasure.
So you mentioned that sometimes nursing homes are a lot like homes. People live there for a long period of time. What are some of the communal type activities that nursing homes might offer for folks?
Probably the most common service that one thinks of when thinking about communal activities in a nursing home is that of dining. Dining is a really important part of our culture. Yeah. When we get together with our friends and family, oftentimes it's around food or a meal. And so that's no different in a nursing home. So what we learned during the pandemic is when folks were not allowed to be in a communal setting because of transmission of infection and because of safety issues, there was a huge loss to that sense of being and belonging, because folks were relegated really to their rooms for a period of time. And so dining is probably one of the most common communal activities, although there are others. There's often holiday gatherings or social engagements and parties and games and recreational therapy that can be also considered part of a communal activity.
Fun. So for those of us who think our pets are part of our family, what should people consider if someone is thinking about a nursing home but they have a pet?
Well, this varies from nursing home to nursing home. There are some nursing homes that accept pets. Pets are, we know that pets are for family members, oftentimes for residents, and they're therapeutic, and they're a very important part of their day-to-day life and their mental well-being. And so that's always recognized. However, there are limitations. There are nursing homes that do not have the capacity to care for a pet in addition to caring for the people that live there. So sometimes a consideration will be given to the amount of care that particular pet requires. If it's a situation where a person is moving in with another roommate, there could be allergy considerations, or there could be other things to consider when going to a community setting with regards to a pet. And always, if a pet is invited to visit a nursing home or to stay there on a permanent basis, there are, of course, health records that need to be maintained for the pet too, such as their vaccinations and their health checkups.
Yeah, that's a lot to consider that folks might not think about. So it's good to be able to talk about those and get that information ahead of time. So we talked about assisted living before the break. If someone is in assisted living, or maybe they're just living at home at this point, at what point in their care should they start thinking about a nursing home?
I think having a full understanding of the condition of the person in need, if they are suffering from what's considered a progressive condition or disease, then it should always be in the back of their mind that this disease could follow the anticipated course and progress. And so as you're looking, and I think educating yourself to your own disease pathology or progression is important. If it's anticipated that there will be a progression, then knowing what to look for and what indicators might come into play. If all of a sudden I lose the ability to use my legs, then that might be a situation where the folks at home can no longer support me, and I'm going to need more skilled care. So I think really understanding your own disease pathology, also having a realistic viewpoint of the capacity of the folks that are currently caring for you. So if you're in assisted living, there are rules and regulations which vary from state to state regarding what cares can be provided in an assisted living. And then if you're living at home, of course, the capacity of those that are taking care of you. Are they healthy? Have they been able to uphold their own health in addition to providing care for you and yours? And then, of course, there's also a financial consideration. Oftentimes, assisted livings do not accept Medicaid and Medicare. And so if one has spent down their resources or becoming close to spending down their resources, that is another time when they want to begin to think about their next alternative for placement.
And so that sounds like just education is needed all the way around first and foremost, but you brought up the financial part. Let's talk about that. So you mentioned that nursing homes do accept Medicare and Medicaid. To what extent or what can people expect there as far as coverage?
Well, both, not all nursing homes do accept Medicare. Most of them do, but not all do. So that is a good question to always ask if you're inquiring with a nursing home. In order to accept Medicare, they would have to be considered skilled. That is one of the criteria. And the other thing that's really, I think, probably disillusion for folks is that they think that Medicare will pay forever and ever for a stay. And actually, both Medicare and Medicaid have funding restrictions and criteria. And so educating yourself to the programs and what their parameters are, I think that's very important. Medicare is usually the most that Medicare will pay is 100 days in a nursing home. And most folks don't even get those full 100 days just because the parameters and the definition for coverage is limited. And then when it comes to Medicaid, there are some considerations. If you are If you are a single person and you have a home and you wish for Medicaid to pay for you to live in a nursing home, then Medicaid will require you to forfeit your Social Security check in most cases. And so you wouldn't be able to maybe maintain another setting as well as have Medicaid also pay for you to be at home. So there are contributions that are required on a personal level, even when you have Medicare or Medicaid. I think that's something that folks oftentimes are not aware of.
Okay, thanks, Jill. We're actually up against another commercial break, so we need to pause here. But when we come back, I would like to talk a little bit more about how folks can get financial help, and then we'll also talk about loved ones who are visiting people who are in nursing homes and what to keep in mind there. Stay with us. We'll be right back to talk about so much more after these messages. Welcome back to Healthy Living for Life. We're still talking with Jill Hult. And right before the break, Jill, we did start talking a little bit about the financial aspect of nursing homes. And I just want to cover that a little bit more because I know that can be a concern for folks. How can they get help beyond Medicare or Medicaid? What are some financial options there?
That's a good question, Beth. So you can oftentimes use private funding sources to pay for a Medicare or pay for a nursing home stay. So private funding, private resources. And also in some cases, there are some fundings available through the Veterans Affairs. Of course, the facility would have to be licensed to accept veterans funding and be surveyed and have, meet their criteria. And one other I can mention, which is not often used or very popular or common, and that is insurance. There are some long-term care insurance plans out there, although over the years, those have been scaled back considerably. So there is some limited support through some of those policies yet.
Okay, well, hopefully people have some options so that they can get that care they need. Let's talk about people who are visiting their loved ones in nursing home. So COVID kind of changed things up there. I know there have been a lot of changes since things started opening back up. What should visitors know if they're going in to visit a loved one?
Well, visitors should know that if they themselves have experienced any illness or are not feeling well, that they certainly, and even if they think they just have a cold or they think they have allergies, they should consider refraining from visiting. We know that we've learned with COVID that it's very difficult to diagnose COVID without testing, and even sometimes testing can have time frames where it's more effective and accurate than at other times. So if you feel poorly in any way that you think could be infectious or related to the things we know to be COVID, then I would encourage an alternate kind of visiting, maybe a FaceTime through phone visiting, or maybe window visiting. If the weather's not inclement, that's an option. So I think just being mindful of your own health status when you come to visit in a nursing home. And then I think also you need to educate yourself. If you're somebody who's immunocompromised or is struggling also with concerns about transmission of COVID or other infections like influenza this time of year, then when you're calling the facility, you could inquire ahead of time to see if they have any outbreaks or any cases of COVID or influenza. And so educating yourself as to the status of the folks that are living there would be helpful. And know that when you get there that you'll most likely be asked to visit mostly just with the person that you came to see. It's considered to be best practices to not visit with a lot of different people in the event that you had an infection that you were not aware of, because you would be in a position of potentially spreading an infection you didn't intend to spread. And in some cases, in some communities, masking is still recommended. So there may be times when the facility will recommend that you wear a mask while you're in the hallway, certainly, or when between going from the front door to visiting with your loved one. And perhaps even while visiting with your loved one, that may be a recommendation from the nursing home.
Okay. Can I take anything in with me if I want to bring a gift, say, or maybe bring lunch? I want to have lunch with my loved one. Can I bring those kind of things into the nursing home?
Yes. In most cases, that's not restricted. There might be an individual nursing home here or there that has something that they restrict or that they screen them a little bit differently, but overall, that is not prohibitive, if it's handled properly. Food is always a little tricky just because of storage. And so if you are bringing in food that you intend to leave in the nursing home, maybe for your loved one to eat later or to have a snack at a different time. Making sure that the nursing staff is aware of that would be helpful. They may need to refrigerate it, or they may need to put a label on it and a date so that food food can be another way of carrying and transmitting disease and infections. So that's always something that nursing homes are very particular about, but just make them aware of what you've done and ask them to help you with that.
Okay, great. And you mentioned the games and activities that they can do while they're in, residents can do in a nursing home, but you also mentioned that maybe I can only just visit with my loved ones. So would I be able to participate in any of those games if I go to visit?
That will really vary, Beth, on an individual nursing home, and even that could even vary within day to day within the nursing home. It may depend upon their if they have any active COVID cases in their facility. That may inform their decision making with regards to communal activities. Influenza, as I mentioned earlier, this time of year is also a consideration, and so that could vary. But in most cases, when there's not an infection concern or there's not an outbreak of any type, then I would think most nursing homes would welcome the participation with some of those communal activities, and maybe being mindful of distancing and masking in some cases. So there may be some restrictions, and maybe not. It will really vary very much between organizations and timelines. What was okay and safe yesterday may not be so today, and so being flexible about that can also be helpful to not set you up for disappointment.
Okay, that's helpful. So we only have about a minute left, but I wanted to ask about the pandemic. We've talked about it off and on in outbreaks and being careful to make sure that we don't get our loved ones sick or other people in the nursing home while we're visiting. I know the nursing homes have put in place a lot of precautions. Can you talk about just a couple of those, and have any of those become law, or does it really depend on the nursing home?
Really, Beth, the precautions with regards to COVID have evolved as the pandemic has evolved and changed, and vaccines have become available. There's been a migration of mitigating factors, and things that what were once considered crucial are now considered maybe flexible in some cases. So there are things to think about. I mentioned them at the beginning. If you don't feel well, please don't visit. I think just being mindful of the fact that you could have an infection and not know it is also important, and just understanding how infections work and just the insidiousness of infections, I think, is helpful. And know that the nursing home, they want residents to be able to have visitors. Everybody wants a social, we miss those connections, but also recognize that the nursing home is responsible for others living there besides the one that you want to visit. And so when they're making decisions and giving directives and guidance and suggestions, it's because in most cases, they really do have everyone's best interest in mind. They're not trying to be restrictive, but they are trying to look out for the good of the whole, if you will. Yeah, no, that makes a lot of sense. And we should be looking out for those folks too, for sure. All right, Jill, that's it. We're out of time, so we need to stop there. But thank you so much for all of your information, and it was great today. Thank you, Beth. And thank you so much for tuning in. We hope you'll come back and see us again next weekend. Until then, stay fit, stay well, and stay healthy for life with Healthy Living for Life. Have a great week, everybody. We'll see you next weekend.
Healthy Living for Life is brought to you by Mountain Pacific Quality Health. We'd love to hear from you. If you have suggestions for future programs, visit our website at mpqhf.org or call us at 406-443-4020. You can also catch us on YouTube by visiting our website and clicking on the Healthy Living for Life logo. Production facilities provided by Video Express Productions.